This podcast is for educational purposes only. The information presented is general in nature and is not medical advice, diagnosis, or treatment. Watching this video does not create a doctor-patient relationship with the hosts. Always consult a qualified healthcare professional regarding your individual condition before beginning any treatment or exercise program. If you are experiencing a medical emergency, seek immediate medical care. All right, everybody, welcome back to the Two Bros and Some Joints podcast, where we talk about different kinds of aches and pains that patients have and what options there may exist, break down common myths, and just chat about our own personal experiences in private practice. With us, as always, is Dr. Nick Hunt, rehab chiropractor from Jacksonville, Florida, in private practice now for over 4 years at Arate Rehab Chiropractic, and I am Dr. Austin Ehmke, rehab chiropractor from Omaha, Nebraska, in private practice now for 4 years as well, over at Body Kinetics Rehab Sport and Spine. Dr. Nick and I graduated together from Palmer Chiropractic in Daytona Beach, Florida, with the mission of one thing: elevating the chiropractic field through an evidence-based, patient-first approach to musculoskeletal injuries. Throughout these podcasts, each episode, our job is so simple: help you guys better understand your body, your options, and everything regarding your aches and pains. Nick, we've got a really fun one today that is always incredibly fun, and it ruffles feathers, and I love it. And we are talking, should we, as rehab chiros, or just chiros in general on paper, should we be doing rehab?
So yes, everybody's favorite, well, our favorite, because we hear this kind of stuff all the time. You've had several people even comment on your, socials when you post things. It's like, okay, so this guy's cosplaying as a PT right now. It's just like,
It's my favorite comment.
no,
It's
no.
my
It's like, no, I
favorite
don't have to
comment.
cosplay as anything. Um, the answer again comes back to everybody's absolute favorite answers. It depends because how you approach this stuff really does matter. And so the way I think that we should start this is, should every chiropractor be doing rehab?
Mhm.
And I think the answer is no.
Yeah.
Even though that's what you and I do, I think that answer is no.
Yeah.
Um, and here's why. I'll give my point and I'll bounce it back to you and see what
Mhm.
your thoughts are here. Um, Not every chiropractor is built the same. We do have the same education, as every PT gets the same or similar education. Their school's job is one thing, and that's to get you to pass boards, not for you to be good at basically anything, but to make sure you don't hurt anybody and you meet the minimum requirements from a legal standpoint to practice. And so that what that doesn't do is make you really good at certain things.
Right.
So those of us like you and I, it really brings out our backgrounds, what we did before we went into chiropractic, and how we apply that into how we treat people versus someone who didn't have that background, went into chiropractic and fell in love with a different piece of it. They had different experiences and they might have thought that adjustments were absolutely fantastic and it was the way you're going to fix so many things. And they got fed certain information. Their mentors talked to them about how important and how crucial the adjustments were. And that was basically it. So they built the way they practice around what they liked, what they saw worked, and then went from there. Whereas you and I had a different background, a different upbringing through it. And we questioned some of those things. It's like, well, how is this going to do this without this? How
Right.
is an adjustment going to help your low back when you have poor stability? How is an adjustment going to give you more lumbar stability?
Yeah.
And for you and I, the answer is it's not. So it
Right.
all also comes down to, what problem are we trying to fix?
Yeah. I
If
get. I guess the easiest way
Go
to
ahead.
start it is like number one, like we are legally able to. We have physical therapy. They're called PT boards of physiotherapy or physical therapy boards. We literally take them. Different states have different requirements for them. In Nebraska, for example, ours is labeled as chiropractic physiotherapy. It's labeled as physiotherapy strictly because of the fact that physical therapy, the words are protected under Nebraska state law. That's something that the Physical Therapy Association, they felt like they were going to necessarily do. The Chiropractic Association did something similar with the words chiropractic manipulation. To me, it's just two different people just pissing in each other's corners, creating more divide in a profession or in a field of like physiotherapy in general that we should all be agreeing in. So like number one, the laws allow us to. Every state's a little different, but for the majority of almost every state that I've ever practiced in, like when we were in Florida versus Iowa versus Nebraska, from like from Pitt to North Carolina to now back down to Florida, like the laws are effectively the same. You can do it. Now, that doesn't mean that you're good at it. That's just like, I don't know, like a generalist surgeon is not going to be incredibly insanely good at, like one of my good friends is a spine surgeon, spine surgery. Like they would clearly agree. It's like, hey, I can do it, but I don't know, I suck at it. There's a difference. And that's where, like, I think at the end we really agree on, like, if your background alludes to it, like yours is in sports performance. You had worked over at Marshall. You had done so much sports performance, so much work with the exercise physiology department that your background is in that. My background is in sports medicine. I worked as an athletic trainer. And so for us, these backgrounds make sense why we want to lean into rehab so quickly. This is because that's what our background was. That's what we really enjoyed. Chiropractic to us was a means to an end, so that way we could practice on our own and continue to see patients with other means of modalities. Chiropractic as a modality is fantastic, but it's not an answer to everything. And anyone who thinks so, I'm sorry, it just isn't. The evidence suggests it. The world knows this. We're not fooling anybody anymore. And I know even when we were in school, we were told it was like it can help the body with everything. It's like, no, it can't. Like, let's just move on. And that's the hard part.
Well,
I think is like is when more of us start to like say like, oh, if we gatekeep towards each other, I think that what it's doing is more harm than good. Where you and I before this, we were even talking like we're okay with physical therapists performing manipulations. Just be good at it. That's all I ask. Just like if there's a chiropractor that's giving an 18-year-old athlete on their way to go play Division I baseball glute bridges because they tore their ACL, but they're 9 months post rehab. It's like, I don't know what you're doing, man. Like, it needs to be the right person for the right goals with the right amount of background and the right reasons. Like that's really where I'm at. And instead of like dividing us further, we should be trying to prop each other up. We should be trying to say like, hey, just how about if you're good at it, you do it. That's really where we're at.
That should be the minimum of it. You brought something up really important there. They try to talk to you in school as a chiropractor, that the adjustment, can fix all. And, they quote all of it. And so for those of you who don't know, chiropractic is a heavily philosophical profession. It is unfortunately a piece of our boards, whereas about philosophy of treatment rather than efficacy of all the treatments. And so
Or I wanted to
while it's
die
not a
studying for
major
that.
part of it, oh, it was awful. So there, a philosophical approach can be beneficial in certain things because at the end of the day, you got to believe in what you do. And that's something that chiropractors inherently do very, very well is they believe in what they do. That helps bedside manner. That helps you convincing people to come patients and actually do something for their pain. Is it the best thing? Not always, because if you're sitting there telling your your patients that an adjustment will fix everything from you know dry eyes, nausea, backaches, if your adjustment fixes all of the side effects of the medication commercials you see on TV, um, you should probably start seeing like there. Well, that how
Yeah.
tell me about how. And if they say anything about nerve interference, then we have a philosophical approach rather than a scientific approach.
Right.
Um,
And that's where I
and
think like there's a space where we can all agree. It's like if there are those of us who want better for both professions. I want physical therapists. I want chiropractors. I want us to start to exist in spaces together. Even we were looking at research for like a later episode we're recording here. We kept seeing the only thing we saw was this versus this versus this versus this, like over and over. And it's like, has anyone thought of just combining them? And it's impossible to find research that supports or even not even supports it, just research that exists that finds chiropractic and exercise therapy together. Why is that so hard to find actual good evidence or any evidence for that existing together? It's always one versus the other, one versus the other. It's like how long does it take you to adjust somebody in reality?
yeah, less than 2 minutes,
So
full
why in the
body. Anything you could.
world, like, can they not exist together? Because we work on 1 hour appointment sessions. So for us, that's what we do and we see it. So obviously we're biased that we're going to say, hey, it's going to do better. But All of the evidence suggests that doing exercise therapy is helpful. All of the evidence suggests that chiropractic manipulative therapy for specific things can make it better. So why can't they coexist? Why can't we do them at the same time? The answer is we can, and they should. But gatekeeping one versus the other, the only thing, and this is like I guess the biggest thing is like if your background alludes to it, like yours in exercise physiology, mine in sports medicine, if your background alludes to it, you're good at what you do, and you know who your patient niche and population is, you should be doing it. Otherwise, you're effectively becoming a disservice to those people around you. Now, that also says, can you draw the line as to, like, would I help train an 85-year-old geriatric patient on fall prevention? No, I'm not good for that. Don't come to me. Go see. I have a friend who's a physical therapist that specializes in geriatrics. Go see him. Like, don't talk to me about that. I don't want to see that. No, I'm not good at that.
Absolutely. And there's a defining line there. Um, if you have a background, and I remember having conversations when you and I were in our student clinic days with some of the other interns, and they're just like, they look at us and say, "Well, what should I do for like the rehab in this?" And it's like, there's like, my mind just doesn't work that way. Like, then that's probably not what you should be doing.
Yeah.
You shouldn't necessarily go in there and either waste time. You risk, having a negative outcome, potentially hurting somebody more because they're doing an inappropriate movement at an inappropriate time for a condition that may or may not require a certain thing, and you're still going to have them do that. If you don't know what you're doing, then don't do it. There's nobody sitting there twisting your arm and saying you have to do rehab, because
Right.
more often than not, we would actually be more rewarded to just do the quick little thing and run to the next person and do the same thing. Uh, However, our minds, our hearts, everything that we have morally in us is like, well, I can help somebody more by doing this thing. And that doesn't mean somebody else has that same pull to do so. They don't necessarily have the background, the understanding of saying like, oh, well, I know how I would treat this. I know what's going on here. They don't have the experience of doing the activity that they're trying to do.
Mhm.
And they don't have necessarily that expertise in the background of saying like, this is actually going to help. You actually need to do this in order to get good at this. So in those people, it's like you might be doing them a disservice by adding rehab into this.
Yeah.
So
Finding that balance of what you're good at and what you're not. And unfortunately, it happens all the time too, where when you've had this happen and I have this happen, I continue to, especially the more integrated you get into the Jacksonville area, because you're new in that area, but myself over into the West Omaha Elkhorn area, the more integrated I get, the more I start to work with a lot of teams, because they find out, they're like, wait, he has an athletic training background. He's been I'm coming up on a decade now of being inside of the sports med field as an athletic trainer. Worked with so many great staff, from physical therapists to chiropractors to athletic trainers to surgeons, all across the board. I've had a great experience, a long experience. I love it, and I look forward to another damn 10 years. And I can't believe it's 10 years. I love it. I don't do as much of it as I used to, however, because I'm not on the field obviously as much. But I'm now in the clinic doing the rehab, working with athletes. If you have never been an athlete in a sport, if you have never done the sport before, what was it Hodges used to say? Is
mhm.
if you've never done those things, if you've never been an athlete in it, and you've never even tried that sport or walked in their shoes, you probably don't have business taking care of them. This isn't to try and gatekeep you. It's so that you have a degree of empathy. You have a better understanding of what does their return to play look like? What does their rehab need to look like? And how do both those together get them to where they need to go? That's all we're trying to say, is if you
Oh,
don't know what
yes.
is best for them, then you need to go find someone else inside of your team to help them. It's not that I don't like you. It's not that I don't like PTs or that I don't like chiropractors. I've freaking just told you I worked with so many amazing ones, and you have as well over your life of being in this field. It's like all we're trying to say is do what's best for the patient, please. Like you and I, we can drop our ego in a half split second. It's like, yep, nope, this isn't me anymore. I don't take care of that. Like, what's this
Yeah.
thing growing from my
Oh, yeah.
elbow? Yeah, no, I don't take care of that. No, see ya.
Yes,
See you later.
that's above
No,
my pay grade. We're not talking about
it's
that.
ew. That looks gross. Don't
No,
touch me with it. Leave.
it's exactly it. We don't have any issues sitting there saying, okay, so I work with people with pain. I work with people who are athletic populations. We do this. Okay, when someone comes in and says, "Hey man, can you check out my tooth? Like I think I got this like infection going on here. Look at my gum line. Is that
Yeah,
bad?" It's like, I don't know, dude. Go to your dentist.
yeah,
Don't, like that's not my specialty. And I think that people need to drop their egos and sit there and stop saying, I have to have the answers for everything.
Yeah.
When you talk to, you brought this up earlier for surgeons uh, s- uh, get specialties.
Yeah.
They
Yes.
get really deep in one thing. When you have an experienced surgeon, one guy does brain surgery, one guy does hand surgery, other guy does knee replacements, and that's it.
Yeah.
They know their lane and they say, hey, I'm good at this. I do knees. You ask me to operate on your shoulder. I mean, this comes back to the legal. It's like
Yeah.
legally they can,
Yeah.
but should they be the one to do it?
Right.
It's like, no, go to the guy who does that every single day.
Yeah.
If you
It's
have that tooth issue, I'm not going to touch it. I'm not looking at you as like, there's nothing I can do for that. You
I
need to go to the guy who does that every day, who will know exactly what's wrong, exactly what to do, and exactly how to get you where you want to be.
right.
Because that's what each of us need to do. And that's dropping the ego of saying, I handle everything. You've mentioned this several times. You're like, you love working with knees. And, after last week's episode about shoulders, you was like, shoulders are not my thing. For
No.
me, shoulders are it. And I actually hate working on knees. Um, as funny as it is, it's like a trade off.
Right.
It's one of my least favorite things. And it's like, it's not that I'm necessarily bad at it. It's like, I think that my brain gets turned on a little bit more. I get a little bit more reward in my brain, a little more dopamine when I work with a shoulder because I'm like, I'm diving into this thing like a detective. Like, let's figure out this thing. This is complicated. Let's
Mhm.
go. Versus other things where I'm like, just doesn't do it for me.
Yeah.
Um,
And I
a
think
little
go ahead.
another excerpt for it is my wife is a physician assistant in she does dermatology.
Mhm.
She will not do anything else. She will sit there and tell me, well, I'll spit something out
This
about
is
an
a sinus
orthopedic thing.
infection.
She's
I
like,
don't know. Leave me alone.
she's she's like, I don't remember orthopedics, Nick. She's like, no, I do skin. Like that
Yeah.
is it. And she knows. It's like, this is what I'm good at. You
Yeah.
want to do that? Go to your primary. Go to this specialty. They will know.
Yeah.
Like I can send you where you should go. I can tell you exactly where you should go, and we can do the same because we all have that knowledge of this is outside of my wheelhouse. Here's
Mhm.
where you should go.
Yeah.
But so many people hold their ego into it. No, I can get this. I can
I
figure this out. It's like
yeah.
you don't have to. No one's twisting your arm.
Yeah. And in fact that's what like there are there's so many different providers across Omaha that I've learned to work so well with, and that's what's super funny is like even this morning I had a conversation, sat down, and I had a dude spot me on bench, and literally he's in a fellowship working over at Creighton now, and he's getting or he's in his fellowship for infectious disease. And one of the things that I had mentioned, he's like, oh, what do you do? And I was like, I explained what I do, and he's like, that's pretty cool. I was like, yeah. I said, there are those of us who are trying to promote more of the evidence-based approach where we can have both the rehab world, the chiropractic world, everything. We can have it exist together because that's what the evidence suggests. Because the last time I checked, I'm in this for my patients. I wanted to help people get better. And so why would I not continue to follow the evidence? The evidence suggests combining the two, getting rehab involved with it. But specifically, if I know that I can do it. If I can't do it, it goes out. It leaves. It's out of my office. But if I can do it, and I know that I'm confident in it, for me, it's really like, and I know we talk about this, is effectively, for myself, 4 areas. If it's shoulder, low back, hip, and knee. If it's any of those things, yes, it's probably up my alley. Why? Because you think about sports medicine, and we go back to the earlier point, which is like our backgrounds. What did I see a bunch of? From
Yeah.
all of the sports, from all of the athletes, from Division I, semi-professional, pro, all the way down to high school. What did I see all day long? Shoulders, hips, low backs, and knees. That's really all I ever saw. Did I see my fair share of ankle sprains? I don't even mention ankles because it's so laissez-faire to me how many thousands of ankle sprains I saw. But like, there's a reason why it's those 4 things. That's all my background was in. That's what I'm really good at, and so I stick with that. If it's outside of that, I go, I don't know. Are you sure? Like, I appreciate you. Like, your example is like, I appreciate you trusting me to look at your tooth. I appreciate that you have trust for me. Wrong person though. go see
Wrong
someone
person.
else. I'm about to chat GPT your symptoms in like 2 seconds here because
Oh,
I'm just making sure this isn't contagious.
literally, it's like, did I touch it without gloves? Oh, that's bad. Let me go
Right,
wash my
yeah.
hands and then we'll back.
Is this
Um,
contagious? Yes
no,
or no?
Like what you're talking about is exactly it. Like you talked about your background with athletic training. I started out as an athletic training major, so I did a lot of time with my high school back in the day of working with the athletic trainer. I was taping ankles in the locker room whenever I was fresh out, and I was with them working, helping them out, putting some ice packs on whoever, kind of doing under the guidance of the athletic trainer for the school. So I got a lot of hands in that, and then going through the exercise physiology. Once I switched that, it was more performance oriented. It was performance, improving performance. Let's see where we're at. We're doing body fat compositions, we're doing VO2 maxes, we're doing vertical jumps. Okay, how do we take our athletic populations? How do we take at Marshall, I worked with the men and women's basketball team, men and women's soccer team, tennis teams, and all this kind of stuff. And we talked about nutrition for play. We talked about, okay, why is this team losing right now? It's because we don't have the conditioning. We kept running. They kept running out of energy on the tennis court. Um, Less of it was about like rehabbing an injury, and it was all about improving performance. So we looked at the people who did not have um, very impressive vertical jumps, who might be trying to, go play professional basketball. They didn't have a vertical jump that was going to touch where they needed to be. So we made programs, exercise programs, to improve what they were missing. We would do our, what we call now our evaluations on it. And we're looking, okay, so they don't have good transition. They don't actually have good power. They're strong, but they're not quick with it, because we understand that power is weight moved over a specific time. So the faster it is, the higher the power is.
Mhm.
So they didn't have good transfer of weight to get to the higher point. They didn't have shoulder mobility to reach a little bit higher than they could, and they'd add an inch in
Mhm.
the end of one session onto their vertical jump. Um, Training protocols to get them to increase their VO2 max. And so the way I took that and played into this, after going through chiropractic school, I remember people talking. It's like, yeah, you're thinking of this like a ex phys guy. It's just like, should I? Why should I stop thinking of
Yeah.
it like an ex phys guy? Because it's literally just your body and its physiology, how this stuff works. And now we're just applying the same principles into how to heal from injuries. It's
Yeah.
like, why should we be differentiating the two? But then not everybody is necessarily suited for that. They need one track of thinking, and
Mhm.
there's nothing wrong with that, because
Right.
that pulls us right back in the conversation of what lane do you belong in,
Yeah.
and should you be doing this?
Yeah. It's if your brain, if your experience, if your knowledge and your education pushes you down a certain route. And that's what I think we're seeing more of is more and more chiropractors, more and more physical therapists, more and more people in these spaces, at these rehab spaces, are becoming more and more well-rounded, and they're up to date on the evidence, and they're aware of how it works. And maybe they have diverse backgrounds that pushes them into specific niches like ours. It's okay. It's a good thing. It's not a bad thing. Why would it
Yeah.
be bad for more people to be able to treat more things more effectively? It's not. But if you're the right, and I think that's kind of where we can leave it, is if you're the right person, if you're the right provider with the right intentions, with the right reasons, with the right goals, then it makes sense to do it. It makes sense if you're a chiropractor and you're listening to this, or if you're a physical therapist and you're listening to this, it makes sense for us to cross those paths. Why? Not only legally, not only from the evidence, not only from the background of the education that we can, but if it's for the right reasons, for the right persons, for the right time, for the right goals, then go ahead. It does. Because what does everything say that we just talked about is it's yeah, it makes the most sense. Go for it. If somebody else's ego gets hurt about it, that's their own problem. Let them deal with
Yes.
that. If they want to have an identity crisis, that's their issue. It's not my issue. If if you believe, I think we did the math here, right? It was like if you live in a town of 35,000 people and you believe you're the only one that should be able to take care of patients, and you see them the way that we see them, right? Which is like 1 hour visits. We did the math. If it's 35,000 people, it would take you what, like how many? If it
It
was like
is
35,000
so
divided by
so
40 work hours
40
divided
work
by
hours a week.
52
It was
weeks, it would
around
take you like 17 years.
17,000.
It was
Yeah,
like
17
17
years.
years is what it would take to see
Yes.
every single person in that town 1 hour once. It's like,
One time.
you
You
can't
saw
take care
them
of all
one
of them.
time to see everybody.
Stop,
It's
like,
just
stop thinking
inappropriate.
it's only you. It's not just you, it's everybody else. That's why when we talk about our experiences, it's like, look at these teams of people we worked with. They're amazing, they're great. But like Nick said, Look at these surgeons. Look at all of these specialties. Look at his wife. They have specialties for reasons. They're really good. They kick ass at those things. Let them kick ass at those things, and let yourself kick ass at something else specific too. It's okay to do that. There's nothing wrong with it. You got anything else to say before we leave it off there?
Yeah, it's because the one thing I want to touch on here is that is such a minimalistic viewpoint. Is I should be the one to have all these people, and like we crunch the numbers. You literally just can't, because how good is one visit every 17 years to get anybody any improvement? It's not. And 35,000, that's a really small town. You know what
Yeah.
I mean? That's not anything to anything big. And so just taking that viewpoint of like, there's more than enough to go around. You don't have to be so territorial about everything, and everybody in that town, because outside of you might not be the best person for it. Some people just are better fits for other people.
Right.
Do you want to sit and talk with everybody in your town for an hour? I'm sure there's people you don't like that you wouldn't get in there, so that lowers it even farther, and there's just no way.
Yeah. Oh, I just did the math too. Here you go. If it was in Omaha, where we're at, it would take me 235 years to see everybody.
One time. Yeah.
It's okay. We're not in this alone. We are in this together. Work with each other. Get along. Even though some of us, even though some of the older school and newer school people, both, this is not exclusive, want us to piss in each other's corners. Stop pissing in each other's corners. Just get along. It's okay. We are all really good, and we are all really bad at certain things. Just like Nick and I. Please don't show us your teeth. Please don't show us your skin. Unless it's his wife, then you can show your skin to her. Don't show us those things. We have no idea what those things are. Like, just go ask somebody who's better at it, please. We appreciate you for asking us, but don't ask us. We love that you trust us, but don't ask us. It's either, because otherwise I'm turning around and I'm about to take my laptop and chat GPT within 2 seconds to ask what this might be, and then send you to the correct person, because it sounds like it's not me problem. Don't make me do that.
Don't make me do that.
I'm already admitting it's like I don't know anything about this. Yeah. It sounds dangerous, and it smells kind of weird. Yeah, I don't know. I don't think it should be. It shouldn't be here anymore. I like it. All right, well, let's not in my office either. Let's wrap it up there. So that's our answer. Should chiropractors be doing rehab? It depends. It depends. If you're the right person for the right reasons at the right times, it depends, man. I like it. We are Two Bros and Some Joints podcast. We're signing off. We will see you guys next week, where we are talking about something really fun and polarizing, which is lumbar disc herniations. That'll be good. Nick, I know you'll like that one. That's a good one.
It's gonna be fun.
Yeah, it'll be
always
good.
fun.
All right. We'll see you guys later.